So we are currently at the office of the programs manager of the expanded program on immunization, Dr. Amponsa Achianu of the Ghana Health Service, and we are basically here to discuss the just ended administration of the AstraZeneca vaccines across the country. We are here to. Good morning, Doc, and thanks for having us in your.
Good morning. I'm happy to be with you.
We are most grateful. But first off, before we even delve into the activity itself, what exactly is your role as the programs manager of the expanded program on immunization of the Ghana Health Service, administration of vaccines, COVID-19 vaccines in the country?
Okay, thank you very much. So the essentially what the expanded program does is it's one program. So I am a program manager. Most of you say programs. It's just one. There are several other programs which each of which has a program manager. So I am one, a program manager for the expanded program on immunization. Immunization, as you know, saves lives. So essentially, the program started in 1978 as a fully fledged program to contribute to the reduction of what we call vaccine preventable diseases. In other words, diseases that can be transmitted from one person to another and can be prevented by vaccines. So the program is to reduce those conditions as part of primary health care and also ultimately contribute to the poverty reduction strategy of the government over time. So it's not just about COVID. It's a program that has existed for more than 40 years. And essentially what we do, we protect children and pregnant women. But of course, as and when we get any outbreaks, that for which outbreak will be due to vaccine preventable disease, then we intervene as well. So it's because COVID has now got vaccines, it obviously would have to be under us so that we use the experiences we've gathered over time to distribute and deploy vaccines and make sure that people, target populations are vaccinated. So that's our role.
Thanks so much for sharing your role with us. Now to the administration of the second phase of AstraZeneca vaccines. Uh, it was being administered in all the 16 regions compared to the first phase, which we had just selected regions, three regions: Greater Accra, Ashanti region, and Central region as well. What actually informed, the decision to administer in all 16 regions compared to the first three regions?
The COVID-19 vaccines or vaccination exercise, if you will recall, from the 1st of May, when His Excellency the President launched the very first vaccine that we had received from within the COVAX facility. At the time, it was 600,000 doses, and we were the first to receive those vaccines from within the facility. So when we started, we looked at what we call the most vulnerable people and most vulnerable places. So we started with a geographic segmentation, which we dubbed as hotspots. That is, those districts that were driving the epidemic. So in the beginning, it was some 43 districts that were hardest hit. Even within those 43 districts, it was not everybody who had a vaccine. Of course, if you are sharing 600,000 doses to millions of people, you need to be strategic. And so we started with 43 districts during the first phase. Of course, we are still living in the first phase. We've done sub-phases within the first phase. Then we had this from the COVAX. Then we had some vaccines from, if you recall, MTN, 314, almost 315,000 doses. And that we spread across to all the regions. This was around Easter. And we targeted basically the health workers across the regions. Then we had a few other doses, a few thousands of doses from the Indian government. Then, of course, government had also taken some delivery of a few thousands of doses for special populations who were due to go on assignment outside the country. So over time, we had vaccinated people across all the regions. Then again, if you recall, we had some 350,000 doses from DRC, Democratic Republic of Congo, which was also part of the COVAX facility. And that was when we started the second doses of those who had received the initial doses. And so this is more or less a second phase of the second doses, because we had initially done some second doses in May. So it's not as if we are now starting to go nationwide. We did that earlier. So for those other places which received vaccines and were waiting for second dose, those were the target for the most recent delivery.
All right, thank you. The exercise ended this very Saturday. Can you share with us the number of people you've been able to inoculate across the 16 regions?
Okay. So thanks once again. We distributed approximately 240, let's say 247,000 doses across the country, throughout, from the hotspots to the health workers across board. As of yesterday, we had received information that quite a number of the regions had finished, but there still are some regions who are even yet to start. So I wouldn't say the exercise is entirely over. We gave them 5 days. So normally in our campaigns, when we are doing vaccination campaigns, we give a certain period, because you need to give remuneration to the people in terms of feeding and water, especially to volunteers and the vaccinators. So we give a period, but we always have allowance for what we call mop-ups. So if a region for a reason not really theirs, not a cause of not which is not their making, they are allowed to continue. So I have, for example, will start this week, but of course there are just a few thousands of doses there. So we are hoping that within 3-4 days it'll finish. So officially it ended, but technically not. We've so far done about, I'll say, close to 80%. So when all the other regions that started late complete, I'm sure would have hit close to 100.
Do you mean 80% of the entire people you are supposed to inoculate across the country?
Remember, I said that we distributed 247,000 doses. So if there's no wastage, you can only even vaccinate just 247,000 people. So I'm talking about the percentage proportion of vaccines that have been used based on the targets. So it's not like 80% of the entire population. I think we should make it clear. It's based on the availability of vaccines. So I'm talking about the target based on the vaccines.
Yeah, how would you describe the exercise thus far?
The exercise has been quite fine. We started initially with some hiccups as usual. We had quite a number of challenges, especially with internet. And normally when people log on to the system at the same time, we tend to have some issues. But we also have the offline versions. Remember, we've gone live, or should I say electronic. I was saying the not too distant past, when we did mass vaccination exercises, we would just create a form and then tally across. And after that, we input into a database and aggregate. So we only get aggregate scores. So for example, how many doses did Ashanti receive? They would say maybe 200 doses, which forms, say, 80% of the population. This time, we are not doing it that way. We're putting in people's data. And so it's electronic. Therefore, when you have been vaccinated, you have some details of yours in a database. And of course, if you start anything, there will surely be some teething problems. And as we go on, we resolve them. So far, we have an offline version for that particular application. And we will perfect it as we go. So those are, I'll say, the major challenges.
As a country, we already have an issue of vaccine acceptability, where people think that people are not willing to take vaccines because of their own reasons. What is the Ghana Health Service and also other agencies in collaboration doing to encourage more people to take in the vaccines?
So you are talking about demand generation. Yes, it's more of a communication issue. People need to get the right information. When we started all these vaccination exercise, even before, there were lots and lots of social media postings that suggested some conspiracy theories and all that. So once you debunk these things, people get confidence. So we have a whole communication strategy which we have shared. We did that with quite a number of stakeholders, including WHO, UNICEF, all our development partners, BSI, PATH, USAID, and all that. So we have a whole communication team that is led by the health promotion department within the service. And along the line, or before even the full rollout, we also had a lot of interactions with the NCC. But of course, this is a very technical field, so the Ghana Health Service has taken it upon itself to give the right information at all levels, national, regional, district. So this communication strategy is what within that we derive what we call the key messages, the facts and the key messages which we share on social media, and then when we have interactions with the media as well, and the opportunity comes, we do that as well. So that's a strategy.
So early this year, the president announced some 17.2 million doses of vaccines, which will be procured by the end of June 2021. I want to find out from you if you're able to meet that procurement target.
Well, I am not too sure of whether it was all 17 million doses by end of June. That I'm not sure. But what I am sure about is that the ministry put the 17 million doses on the doorsteps of the AU, and that is when a few doses have come already. So it's being delivered in pulses. You got the first 177,000 was it 600 doses, if you remember, of Johnson and Johnson. I'm sure that's what you are talking about. That's what we delivered or deployed not too long ago, even before we got this AstraZeneca. We've also received, I think on the Thursday or Wednesday, we received another almost 250,000 doses. Depending on how fast we're able to deploy this, we'll get another, and then we understand that they will come in millions, maybe weekly or fortnightly. So that's the information I have. So the 17 million doses is being delivered in pulses.
So after this particular exercise, will you be inoculating people before the year ends, or this will be the last administration for the year?
Now we have a lot of vaccines in the pipeline, even within this month. And normally when we get vaccines, we don't leave them to stay in the cold room for long. Once it comes, we plan, we deploy.
Can you share with please?
We are expecting approximately, if I refer to here, approximately 1.8 million doses of AstraZeneca within this week. I mean within this month, by the end of the month. So we deploy that. We also receive Moderna. I don't know if you follow your sister stations. On Saturday, we took stock, or we took delivery of 1.2 million doses of Moderna. We're also expecting about 1.3 million doses of Pfizer. And so within the next 2-3 weeks, we're going to be extremely busy. And the ones we received, the Moderna we received on Saturday, and then the J&J, the Johnson and Johnson received on, was it Thursday or Wednesday? My memory serves me right. We're going to deploy them this week. So it's not like we had done. We won't even finish. We'll move on.
Okay, so finally, by the end of this year, the number of people you've already inoculated and the people you are expecting to inoculate, how many people do you think you can cover by the end of the year?
Well, so practically, I would say that we are limited by availability of vaccines, and of course, not just the vaccines, but also you look at the demand side. Once the supply side, in fact, the supply side has improved. And what I mean by supply side is the vaccines, getting the vaccine. Initially, we had issues with vaccine acquisition. Now it's far, far better. So if the demand side is also quite good, all the vaccines we will get, we can deploy. If we get 16, 15 million doses of vaccines, we can deploy before the end of the month. I mean, before the end of the year. So it's not a yes, no, straightforward answer. We are limited by the vaccines. So if we get it, but for now, if you look at it critically, it means we are getting about 4.4 million doses within the month. And once we do that, within 2, 3 weeks, we should be able to finish.
Okay, so you mentioned it touched on restrictions on or difficulties in having access to these vaccines. Can you share with us maybe the state of those vaccines?
Team to look into how local vaccines could be, local production of vaccines could be done. I know that the team has come up with a roadmap which is currently being shared with stakeholders. The president didn't task people to produce vaccines. That was not it. It was the president constituted a team to look into the production so that once the work is done, it goes back to the president for the next steps. So it's not as if president says I'm tasking people to produce vaccines. No, that was not it.
Thank you very much. Thank you so much for having us in your office to talk about this all important conversation.
We are in this together. I cannot go without saying that vaccines will be the ultimate to get us back on the road in terms of what we used to do previously. Now we are restricted even in social gatherings and all that. However, we also know that there are some interventions that do work. People do not adhere to the protocols, face masking, hand hygiene, physical distancing. We should try as much as possible to do these in addition to the vaccines, and I'm sure that COVID will be a thing of the past.